So what do you do if you suspect you're having an ingrown toenail related pain? So this is interesting. We get patients that come in and they sit in our chair and they say, "Doc, I don't know how the heck this happened." And so first of all, it's really important for us to talk and identify what are the possible causes for this. Number one, usually it's something has fallen or hit it or bumped that toe that has contributed then to the nail starting to curve in and dive into that side of your toe. Number two, we see, especially with kids, they have the tendency to want to pick at their nails. And so it's really takes some effort to be able to teach these young kids and these young people how to actually do things correctly, because otherwise if they pick at it, and they can leave a little bit of a hangnail then on that toe nail, and that can cause it to dive in as well. And I joke with these kids, I tell them, remember that old adage, pick your nose and not your toes. I don't know, maybe you parents may not appreciate that, but that's something that you can definitely help your kids to be able to remember not to be picking at their toes. The other thing that we recommend at the time that you are noticing you're having pain in your foot, figure out, are you having a lot of redness, swelling, drainage, certainly any pain, you'd want to call your podiatrist as soon as you can. What we run into here at Pueblo Ankle and Foot Care is sometimes we get patients calling Friday afternoon as we're just about to close up. And the questions that we ask them are, if you're having a lot of redness, swelling, drainage, pain, those are reasons why you need to have this taken care of before we can get you in on Monday. And we're really good at being able to get patients in quick. We've got several providers, at least 2 in the clinic at any given time, and there usually is an open slot that we can fit you into. But on that Friday afternoon, evening, if you're having infection signs, you really should be going to the emergency room, because there could be a possibility that infection could go down to the bone. And then it's a whole other set of issues that we're dealing with, antibiotics, we need to get x-rays, that kind of thing. But in addition to that, once you do end up coming into the office, it's a fairly simple thing sometimes we don't have to numb up the toe, but if we do, we use a cold spray. The cold spray kind of shocks the skin from feeling the poke and numbing up the toe. And once it's nice and numb, we can remove that offending border. And if it's been a chronic issue for you, we could even do a permanent procedure where we could prevent that nail from growing back again. We give you some pain medication in case you need it, but most people do fine with just regular Tylenol with something like that. We have a kit that has all the medicine, the band-aids, the wash, all the instructions are in the kit. And we also make sure that you have that when you go home, so that you can know how to care for and dress that painful toe. Otherwise, we see you back again in about a week and a half, make sure everything is going okay. Some patients, their toe's doing so much better they don't even feel like they have to come in. So that's what happens with an ingrown toenail, and I hope that was helpful for you.